Hello, hi, assalamualaikum, and very good morning, everyone. Okay, so let's not wasting our time. So today we will cover our last subtopic on the chapter 10, transport in humans and animals. So our subtopic for today is 10.8, health issues related to the human lymphatic system. So in the previous video, we already covered 10.7, the human lymphatic system. Okay, so let's take a look on the learning standards that you have to cover for today. Okay, just on only one learning standards. Describe health issues related to the lymphatic system. Yeah, right. So before we go to the health issues, okay, I want to stress again the necessity of the lymphatic system and the necessity of the lymphatic system, right? So, what are the necessities of the lymphatic system? First, it complements the blood circulatory system. Alright, so how does it complement the blood circulatory system? Apa maksud complement ya? Complement ini dia melengkapkan ya, melengkapkan sistem peredaran darah manusia. So how does it complement the blood circulatory system? By returns the excess tissue fluid in the intercellular space into the blood flow or into the blood circulatory system. Yeah? So that's how the lymphatic system complement the blood circulatory system. So when the excess tissue fluid is returned to the blood flow, the composition, the pressure and the volume of the blood will be maintained at a normal range. Okay, that is the first necessity. Okay, second necessity is referred to the lymphatic system involved in the body defense mechanism. Yeah? So how does it involve? By having a lymph node. So we have known that lymph node is one of the component of the lymphatic system. Yeah? So lymph node will produce and store the lymphocyte. It will produce and store the lymphocyte. So the lymphocyte will involve in the production of antibodies. Yeah? So in other words, the lymph node will produce the lymphocyte. The lymphocyte will produce the antibody. Okay, the third necessity, the transportation of fat-soluble substances. So, in the previous chapter, we already learned that lacteals, the lacteals. So, lacteals are one of the lymphatic capillaries. So, the lacteals will transport the fats and fat-soluble substances, right? And then what happened to the fat-soluble substance that being diffused into the lacteal? So these lipid droplets are transported to the thoracic duct and the blood circulatory system through the left subclavian vein and then return to the blood circulatory system. Okay, so that's the refer to the necessity of the lymphatic system. So it involved in the complementary of the blood circulatory system, involved in the body defense mechanism, and also transport of fat-soluble substances. Okay, so let's go to the health issues related to the human lymphatic system. So the tissue fluid, right? So the tissue fluid. So we already learned how does the tissue fluid form, right? Okay, we already discussed the formation of the tissue fluid. So make sure you still remember how does the tissue fluid is formed. So the tissue fluid that is not returned to the blood circulatory system will accumulate in the intercellular space. Yeah, so actually all tissue fluids, actually all the tissue fluid must be returned to the blood circulatory system. So 85% of the tissue fluid will return to the venule end, venule end of the capillaries, and another 15% will return through the lymphatic system to the blood circulatory system. So if there if there are tissue fluid that is not written, yeah, so what happen? It will accumulate. Yeah, it will accumulate in the intercellular space. So it will result in the swelling of the body tissues. Yeah, result in the swelling of body tissues. Dia akan menyebabkan apa? Menyebabkan tisu-tisu badan mengembang, ya, membengkak. Yeah, as we can see from the diagram here. So this is referred to the this condition is known as edema. Look at the spelling here, O-E-D-E-M-A. Edema. So this is referred to the edema. Yeah, the swelling of the body tissue because the accumulation of the tissue fluid. Yeah, the accumulation of the tissue fluid in the intercellular space. So edema may be caused by a number of factors. So there are many reasons of the edema, right? Okay, so we go to the causes of the edema. First, pregnancy, prolonged bedridden patients. Ya, ini merujuk kepada pesakit yang terlantar lama di atas katil, ya. Then deficiency in plasma protein and also parasitic infection. Okay, so let's go one by one. So pregnancy, that one of the causes of the edema. So the body will produce more body fluid to fulfill the needs of a growing fetus, right? Okay, that is referred to the pregnancy. The body will produce more fluid, yeah, to fulfill the need of growing fetus. Okay, next we go to the prolonged bedridden patients, especially for the coma patient. Yeah. Paralyzed or stroke patient with limited mobility can suffer from edema in the legs. Yeah, usually the paralyzed patient or the stroke patient that should be on the bed for a long time. So with a limited mobility, a limited movement, so this patient will suffer from edema in the legs, especially in the legs. Okay, next we go to the another causes of the edema, refer to the deficiency in the plasma protein. Okay, deficiency in the plasma protein. So deficiency of the plasma protein here involves the deficiency of the albumin in the blood. Deficiency of albumin. Albumin is one of the plasma protein, right, in the blood. So it will cause edema if lack of albumin in the blood. Okay, next we go to the parasitic infection. Parasitic infection, jangkitan parasite. Ya, parasitic infection, jangkitan parasite. Right. So the parasite worm, Brucia species. Yeah. Okay. So infects. So this parasite, the parasite is referred to the worm. Yeah, worm. Right. A name as a Brucia species will infect the lymphatic vessel and prevents the flow of the lymphatic fluid. Alright, so this parasite will breed there in the lymphatic vessels, and then it will block, it will block the flow of the lymphatic fluid. Alright, so the infected part, for example, leg, so leg will swell. As you can see from the diagram here, you can see the leg swell, swollen because of the lymphatic fluid is blocked. The lymphatic fluid because the lymphatic vessel actually is blocked, and will prevent the flow of the lymphatic fluid back to or return to the blood circulatory systems. So this patient experience or contract lymphatic filariasis. Lymphatic filariasis. So this is referred to the disease. Disease of the lymphatic filariasis. Right? Okay, the infection of the worm, parasitic worm on the lymphatic vessels. So it will cause the accumulation of the tissue fluid. Accumulation of the tissue fluid in the body tissue. So this one is transmitted by mosquito bites. Alright, okay, so that is referred to the parasitic infection, yeah, that caused by the worm, yeah, Brugia species. Alright, so that's all I think for this subtopic. Alright, so please do your revision, your self-studies on the chapter 10, transport in the humans and animals. Alright, so I hope you can understand all the subtopic. Yeah, if you think that you still weak on that subtopic, please do your revision more. Alright, so that's all for today. Take care, everyone. Have a nice day.